Well, here to tell us another secret women often keep from men is Jessica. We are anxious to hear, Jessica.
Okay, so for the past couple of years, I've been keeping a minor secret. I urinate a little bit. I call it laugh attacks when I'm laughing or like when I cough. And it's so bad because I'm like so crazy and like, yeah, everywhere that I laugh a lot. So I'm like, oh, thank God for those little things called panty liners. So I need to know, is that like regular or, because I'm so young, you know? So I didn't know if that was something average.
I wish I was laughing that much, because that's a good sign.
Laughing is good, but you're saying that you
share
leak
with your
urine a
husband.
little bit when you laugh. Is that what you're saying?
Yeah.
And that's really common. It happens to women at all ages, and it can be due to not just lower estrogen, that's usually what happens later on, but childbirth, sometimes abdominal masses, sometimes bladder infections, sometimes just a weakening of that pelvic floor muscles, you know, and that can happen any time. But one thing I wanted to ask you is that, do you have this sometimes when you have sex?
Oh my God, yes. Okay, so like I'll run out, we'll like be in the middle of it and I'm like, oh, gotta run out. He's like, what's the matter? Oh, gotta go real quick. And I feel like awkward. I'm sure he's like, what did she run to the bathroom for? I run to the bathroom because I have to go urinate again.
There you go. And these are, again, good things that women should speak to their doctors about, because there's a lot of studies that we do first to try and determine what kind of incontinence you may be having. If it's just a little sporadic, you need to do just little Kegels things, or if we need to do urodynamic testing or give you medications for it, depending on what type of incontinence. But this can happen very often during intercourse, and this is actually, you know, you may want to communicate to your partner after you've, you know, gone to the doctor, so that you don't interrupt enjoying sex. I mean, because you're still laughing, which is great. So you still want to have sex, but you don't want to have to run out of the room every time.
Every time.
So you want to communicate there so that you guys can work through how to have sex with it until you can get an answer from your gynecologist, because it can be fixed and it's not always surgical.
Okay.
And I don't think there's a right or wrong answer as far as keeping this a secret from your boyfriend, but what I will say is that communication is so very important in a relationship. If you communicate openly, then he'll understand what you're going through, and it doesn't have to be something that interrupts your laughing in life and your sexual relationship.
And then he'll have to pee too.
No, but you know what I think this brings up, you know, we're talking about communication is really, and I think for a lot of women, communication with their doctors too, because they can solve a lot of the embarrassing things that women keep secret. They keep it secret from their doctors and their partners, but if they start talking to their doctors a little bit more about these, sometimes we can make these problems go away, and they don't need to be secrets anymore. And this little thing is another, is a mesh that sometimes can help lift up the bladder. And this is the bladder here, but we can put this in, you know, minutes. So start your discussion with your gynecologist, but also communicate with your partner too.
And I do have to say, us men, when we laugh really hard, we pee in our pants a little bit too.
Sure we do.
Yeah.
Especially as you get older.
And any guy who's never experienced that has never had a good laugh, right, Drew?